You may have a inclination to be a little afraid. You may have an inclination of, what if I'm not? What if I'm not? Let's look at the other side. What if you are?
Thank you for your answer to the call to this project. It is important for us here in South Central to highlight those that serve in our military and uniformed services. Can you tell me the branch that you serve in?
We serve in the United States Public Health Service.
And what does that entail? Because I don't think people know about the military. You know, the Army, Air Force, Navy, Marines, Coast Guards, and we know that the public health service is there. But what all does that entail? In a brief statement.
Okay, so a brief statement. The United States of America has a Surgeon General. The Surgeon General has an all-commissioned corps underneath. And what do? We take care of the nation's health.
And what aspects? Like, what can you give me an example of what you do or what you are working on now or oversee? I know you said you're in the state of Texas, so what does that look like for the state?
Okay, so let me first of all answer your first question, and then I'll go into the second one.
Understood.
First one, the Surgeon General is tasked by the Assistant Secretary of Health through the President. We have an issue, we need to go and take care of it. So it's all about health. So
kind of like the measles epidemic that came out of West Texas, maybe?
The measles epidemic, Ebola, HIV/AIDS when it was first known, and we didn't know anything about it.
And so what do you guys do with that, though? So you know that there's something coming up, right? So what is your action as public health?
So I am a registered nurse. I take care of people's health. I am tasked with orders just like anyone else. We need you to go here and take care of this population until such time as they can take care of themselves, such as Ebola. We went over across the water, the sea, and we took care of Ebola patients.
Okay.
We stood up a full hospital, and that's what we did.
Okay. So you also stand up hospitals stand them up where they're needed.
Yes.
Okay.
And I'll say, when we're not serving, when we're not deployed, we serve in the underserved federal agencies. So I am currently stationed at Centers for Medicare and Medicaid Services in Dallas, Texas, and I do long-term care enforcement. So nursing homes, nursing facilities that go in, making sure that they're following regulations. And when they don't follow the regulations, then that's where I come in enforcement, and I impose federal remedies, denial of payment, civil money penalties, and things like that. So a lot of our officers, when we're not deployed, we serve at those underserved federal agencies.
Kind of like a check and balance, like an audit in a way. Okay. What first inspired you to serve in public health, and how has that calling shaped your outlook on life?
So for myself, I wanted to serve my country, yes, but I wanted to do it in something that inspired me, something that was my passion. I am passionate about health. I'm a nurse, a health educator. I wanted to make sure that I made a difference in that venue.
Now, did that come when you were in college, you joined as in the health administration, in the public health, or what was that process?
Okay, so no, I was already done with all of my schooling.
Okay.
Bachelor degree anyway. And that's when I joined the United States Public Health Service.
Okay, and for you?
Yeah, so for me, I actually am a nurse practitioner by trade. So I went to graduate school, did my undergrad studies, and I was working in the private sector, and I just didn't feel that fulfillment. My sister served enlisted active duty in the Navy, and I got the experience to go on a Tiger cruise where we went for a week on the ship, and it really just inspired me to just be a part of something that's greater than myself. And I looked at serving in active duty as far as the military. And once I had a professor to tell me about the public health service, and I was super interested because it's a service just strictly for health professionals.
And it's very different from being in the medical corps with the military, because although there are officers in the medical corps, we have nurses and doctors, they get deployed. So they might not be operating in their field sometimes, but for public health, you guys stay in your field of operation.
That is correct.
In what ways has your military service and your work in AKA, or the services in the uniform services, and your work with AKA complemented or strengthened each other?
So, as I said, I'm a nurse and health educator. I've served in the Federal Bureau of Prisons. I've served in the ICE, Immigration and Customs Enforcement.
Yes.
So with AKA, we have different conferences. And those conferences, we need medical personnel on duty at all times. So I mesh the two
Together. Now, how have they complemented each other in the community?
I would say for me in the community, not only in my chapter, but at my church, we always have questions all the time. What should I do about this? Where should I find this? Hey, can you look at this piece of paper and tell me what that says? Hey, I need something to ask my doctor about. How do I say this?
So you're providing education because the representation is not always there for us at the doctor's office. So then you're providing the education that they're not receiving from their primary care.
Yes, ma'am.
So what about you, Sullivan?
And so for me, of course, I serve my country, and I also serve, like I said, in the sorority, but also my church. So I serve on the medical ministry at my church, and we do different outreaches whenever there's a emergency response, a congregation member not feeling well, ill. I basically provide response.
Is there a time when you felt that the two really made an impact? Like really? Like you could thought, gosh, I'm glad I did that because it changed somebody's lives, or it made somebody have a different outlook on it, just AKA and public health.
Yes. When there's a tsunami, when there's a hurricane, when different tents have to be set up, I know how to do that, and I'm able to do that. American Red Cross in the Dallas-Fort Worth area have me on callback all the time.
So talk to me about that. When you go and set up a medical tent, what all is entailed, and what is the need for it? I understand you talked about the tsunami and you talked about the hurricanes, but what is the need? What does that process look like to say, okay, we need to go set up this medical tent here?
So for United States Public Health Service, we get orders and we have to go. We have kits that we take with us, and I know how to set those kits up because I've done it before.
Right.
If it's American Red Cross, they have certain things that they have to set up. They'll use a public building that has been, offered to them or whatever. And so we'll go and walk through the building and say, okay, you can have this in here, you can have this in here. No, we have to have bathrooms within a certain amount of feet. You know those things because you do it on a regular basis.
So it's also about keeping what is that word? The contamination down.
Infectious disease.
Disease, keeping all of those things together and in place. What about you, Sarah? How has there been a time where you felt you truly made an impact in the community where the two may have intersected?
I will say in the community, I'm a mental health nurse practitioner. And so I can recall an incident, like I said, when I was serving at my church actually, and there was a congregation member. And physically he wasn't feeling ill, but I knew that there was just something deeper that was there. So pulling from my training and experience that I've learned in the public health service, and also just my background of what I know as far as my education, we were able to kind of provide him with more services that he needed because he was going through something a little deeper than just his physical. He was dealing with the loss of a family member, job, other circumstances. So being able to see the person as just a whole, and not just the element of what he was going through.
So the next question I have is, what drew you to Alpha Kappa Alpha sorority, and how has your membership influenced your personal mission and service?
I grew up around Alpha Kappa Alpha. My aunts, my cousins were all a part. I have Ivies beyond the wall already. So to grow up that way and then go to a university that had no D9, no anybody on the yard, that told me it's time to step up.
Right.
It's time to make this happen.
Okay. And you?
And so for me, actually, I have aunts that are AKAs, but my mom actually is a Delta. And so I grew up basically kind of under her wing. But once I went to college and I kind of got to ask myself, what do I truly want to do? Where can I truly see myself serving? And I made that decision to step out, and I ended up joining Alpha Kappa Alpha sorority.
And like you, my grandmother is a Delta. My godmothers are Deltas. And so when I pledged, my dad was like, have you called home yet?
Yes.
So I understand. So let me ask you this. What message would you share with future generations of women who may have been called to serve both their country and their community? Let's start with you, Sword.
So I would say don't be afraid to accept the call. God has called you to do greater, and trust him, and know that you have support with your sorority. You have support with your community, and it's just so fulfilling.
How about you, Sword Michelle?
Yes, you may have a inclination to be a little afraid. You may have an inclination of, what if I'm not? What if I'm not? Let's look at the other side. What if you are?
That part.
What if this is the reason you're here on this earth? God doesn't make mistakes. And if it's been put before you, step out. If you make one step, he'll do the rest.
And what would your final message be to the world as they watch this about your public service and your service to all mankind?
We are here to help. We want to see you healthy. The reason United States Public Health Service is there is to take care of the nation's health. We want to do that. That's what we're here for.
And for you?
And for me, I would say, of course, serve others, serve your country, but also being sure to put yourself and being able to take care of yourself. You're no good to others if you don't take care of yourself first.
Okay. Well, thank you for your time and sharing your story and how important your public health service, your uniform services with public health is to our nation, not just your representative, your respective states, but to the nation. And thank you for your service.
Thank you.
Thank you.